Today's call is going to discuss the role of gut health in autoimmune disease, and we're going to use thyroid autoimmunity, particularly Graves' disease, which is autoimmune hyperthyroidism, as our model. And this is a study that came out in 2020 that connected for the first time gut dysbiosis or imbalance in your gut microbiome, particularly poor probiotic levels or imbalanced probiotic levels, and the impact on the immune system, which results in Graves' disease. And this is really cool because, if you are interested in health, you read health blogs, you listen to health podcasts, you read health books like mine or other people's, then you oftentimes read about the gut in those articles or in that book, or hear about it on those podcasts, or see it in those videos. And the reason for that is because up to 80% of the immune system resides in the gut. And so if the gut is unhealthy, imbalanced, inflamed, leaky, hyperpermeable, whatever you want to say, then that can directly impact the immune system and lead to immune activation, chronic inflammation, and ultimately autoimmune disease and or other issues. So this study is important because this is the first one to connect gut dysbiosis with immune dysfunction that results in Graves' disease. And we can use this as a model to extrapolate to causation or induction of other autoimmune diseases of a non-thyroid organ. So let's jump to the graphic. Actually, before we jump to the graphic, let's draw a quick picture. Actually, I don't need to draw a picture because it's in the graphic, so we'll go there. Welcome, Amanda. If you could mute yourself, please, I'd appreciate it. So by the way, this is the Journal of Clinical Endocrinology and Metabolism. And for those who are listening to this on a podcast, the article is entitled Gut Dysbiosis Contributes to the Imbalance of Treg and Th17 Cells in Graves' Disease Patients by Propionic Acid. Whoever is not muted, please mute yourself. All right, so all the way down on page 20 here is the graphic that we want to look at. And to orient you, up here at the top, this is your gut, okay? And so the top, these yellow things up top here are cells, and then you have another layer of cells down here. So picture this as a cross section between your gut barrier or your colon. And in between the yellow cells is the lumen, or the tube of your gut, right? So you're an open hole, mouth to anus. Just because you swallow something doesn't mean it's inside you. It actually has to be absorbed through that gut barrier to actually enter your body, right? And so the gut lining is only one cell thick. It's a one layer of epithelial cells. So if your gut becomes hyperpermeable or leaky, so to speak, then more things enter the body than would necessarily be allowed if your gut had normal integrity. And so things getting in that shouldn't get in, or getting in more often than they should, can lead to immune activation, inflammation, etc. And in this lumen, or in that tube, is where your probiotics live. So a healthy colon has healthy amounts of probiotics and not overgrowth or unhealthy amounts of pathogens or potential pathogens. And if there's an imbalance between those things, bad things can happen. But you could have bad things happen without gut pathogens. If you say you have no gut pathogens and you just have poor probiotics, you can still have bad things happen, because the probiotics produce, you can see in the center of the graphic here inside the gut lining, short chain fatty acids. Okay, and short chain fatty acids are things like propionate and butyrate that nourish the colon. They have anti-inflammatory impact in the GI tract and on the immune system, and they promote gut barrier integrity or prevent excess permeability or leakiness. And so this is a graphic showing that when you have a decrease in probiotics, you have a decrease in the short chain fatty acids associated with that, because the short chain fatty acids are made by your probiotics by fermenting the fibers that you eat. So if you've ever taken a probiotic or read about probiotics, you've probably come across the term prebiotic, and prebiotic is the food for the probiotics. And most of what the probiotics like to eat are the fibers in our diet. A low fiber diet doesn't feed our probiotics, so that can have a negative impact on your microbiome. And you're also, by not feeding them, having lower short chain fatty acid levels. So you're lacking the anti-inflammatory effect of those short chain fatty acids. You're lacking the colon nourishing effect of those short chain fatty acids. You're lacking the the gut mucosal barrier support that those short chain fatty acids provide. So that's one way that you could have issues, gut issues, immune issues, without having pathogens on board, just from having insufficient probiotics. Now you could have insufficient probiotics and pathogens, and it could be even worse, right? So it's kind of a seesaw between, do we have enough probiotics, and at the same time not have too many pathogens and have good immune surveillance of those pathogens. So that's that gut lining layer. Now below, if we're looking from like an outside in perspective, between the cells is the lumen, or the colon, the tube. Once it's absorbed through the cell lining here, we'll just say for the purposes of this graphic, if we absorb through the bottom layer of cells, now we're inside the body, and immediately inside those cells is a layer called the lamina propria. And the lamina propria is where the immune system is happening to a large extent. So you can see that in the graphic, in a normal situation, normal probiotics will promote normal short chain fatty acid levels. In this instance, propionate will pass through that barrier, be absorbed, and it will impact the immune phenotype, or the balance between different T cells. And so of note in autoimmunity, if we back up, if you read my book in the introduction, I go through the various types of T cells in our adaptive immune system. Currently, science knows of 7 different T cell phenotypes. So this picture is breaking it down to just 2 of those, T regulatory cells and Th17 cells. And these two, the balance of these two, goes a long way in determining the level of inflammation in the gut and the risk of autoimmune disease, because T regulatory cells do what their name says. They regulate the immune system. They promote balance. They are, say, the conductors of the immune orchestra. Th17 cells, when inappropriately high, are the cells involved in the tissue damage caused in autoimmunity. So if we have sufficient T regulatory cells with balanced Th17 cells, then we're not going to be promoting autoimmunity. If we have too few Treg cells and relatively more Th17 cells, that could promote autoimmunity. If we have too few Treg cells and too many Th17 cells, that could also promote autoimmunity. So the short chain fatty acids help promote balance between the Tregs and the Th17, so that we have physiologic inflammation, not inappropriate inflammation. T regulatory cells promote tolerance, which is a concept of recognizing self. Okay, so there's 3 types of tolerance. There's oral tolerance, there's chemical tolerance, there's self-tolerance. Oral tolerance is tolerance of your foods or the things you swallow, right? So if you lose oral tolerance, you might start having food reactions where you could in the past eat a strawberry, now you react to a strawberry. That's a loss of oral tolerance. Chemical tolerance is walking through the Macy's perfume aisle and falling apart, having a headache or brain fog or nausea or something like that, right? You're intolerant to chemical exposure. And then self-tolerance is the ability of your immune system to tell the difference between you and not you, right? Friend being you, foe being anything foreign. So if you lose self-tolerance, you start to shoot at yourself in addition to bad guys. And so that is autoimmunity. If you shoot at yourself, you're developing autoimmune disease because you're attacking yourself, right? Immune attack of self. So we want to promote tolerance. And the major tolerance promoting cells of the immune system are T regulatory cells. So propionate, the proper probiotics, the proper production of short chain fatty acids are a couple factors that influence the Treg Th17 balance. And when that becomes imbalanced, that could drive autoimmune disease. Other predisposing factors to autoimmunity could be genetic predisposition, smoking alcohol, being female, pregnancy, diet, stress, infections. There's lots of different causes of autoimmunity. And again, in my book, I call them, the three factors are the exposome. All things you've ever been exposed to in your life have an impact on your health. The epigenome, which is epigenetics, your lifestyle, your choices, and the microbiome, the bugs. So this study is looking at Graves' disease, and specific to Graves' disease, the research shows that there's a genetic predisposition often involved. Smoking and alcohol, increased risk. Being female, again, increased risk. Pregnancy, increased risk. Diet, stress, infections. And also not listed here, I guess it would fall under stress, would be emotional trauma is often a triggering event of manifestation of Graves' disease. And that could be loss of a sibling, that could be moving cross country and totally uprooting your life. That could be various things. How could pregnancy drive autoimmune disease? Well, we talked about 7 different T cell phenotypes, right? And so Tregs and Th17 are 2 of them. Th1 and Th2 are 2 more of the 7. And during pregnancy, trimester to trimester, you're flip-flopping between Th1 and Th2. And so if we put those 2 on the seesaw here instead of the Tregs and the Th17 cells, again, the flip-flopping in a specific woman that was maybe already Th1 or Th2 dominant, pregnancy could add more dominance to whichever her bias is and drive autoimmunity in that individual. Oftentimes, it's associated with birth of a boy is something I've noticed in my practice anecdotally. So, a woman will say, yeah, after my 3rd kid, I developed Hashimoto's, say. And I always ask, was your 3rd kid a boy? Because it seems to be that boys drive it, births of boys drive it more. I don't know, take it for what it's worth. So the short story is there's lots of drivers for autoimmune disease. Each person's case is different. And that's why we don't want to just say, oh, you have Hashimoto's disease, then it was this that caused it. Or you have rheumatoid arthritis, and it was this that caused it. There's multiple contributing factors. Each case is different. In this paper, we're looking at Graves' disease. So if we sum it all up, what's very important, the importance of this paper is that the researchers specifically looked at the gut microbiome and found that when the gut microbiome is imbalanced, the resulting imbalance in bugs and imbalance in short chain fatty acids leads to imbalanced immune system, loss of tolerance, and attack on self to drive Graves' disease. Graves' disease is autoimmune hyperthyroidism. So symptoms are rapid heart rate, heat intolerance, tremors. You might have signs like protruding eyes. There's lots of signs and symptoms, and basically it's the opposite of hypothyroidism. So that's a model for inducing the cause of inducing Graves' disease. But like we said at the beginning, this model could fit other autoimmune diseases generally, maybe not specifically, but generally. So what's important from the study to take away is if you're someone with Graves' disease and you're like, this came out of the blue, where did it come from? A couple things they found was that they looked at the breakdown of the microbiome in healthy people versus Graves' disease patients. And a big finding they came to was that 3 specific bacteria, Bacteroides or genera of bacteria, Bacteroides, Allostypes, and Prevotella could distinguish Graves' disease patients from healthy individuals with 85% accuracy. So imbalance in those three specifically promotes Graves' disease. And the one that was most highly related to inducing Graves' disease was a species called Bacteroides fragilis. So they found that low Bacteroides fragilis led to low propionate levels. Low propionate led to imbalance between T regulatory cells and Th17. So lower Tregs, higher Th17, which leads to higher inflammation, loss of self-tolerance, Graves' disease. So there's the mechanism, one mechanism of Graves' disease or thyroid autoimmunity, directly related to the health of your probiotics, the level of your probiotics, and the associated short chain fatty acids. Is that the cause of every Graves' disease case? No. But could it be a cause of your case? Yes, especially in combination with those other factors: genes, lifestyle, gender, stress, diet, infections. So let's open it up for questions.
I thought the graphic was really good and really, it explained it well and it's really clear. Did I miss something? What does the LPS stand for?
No, you didn't miss it. I just didn't go into it, but
okay,
that's fine. LPS, it's a good question. I was focusing on the probiotic side of things. Okay, gram-negative bacteria that you can see up here. Let me get my pointer. That's a great question here. Let me get this. So up here in the corner, you can see gram-negative bacteria listed. Mm-hmm. Gram-negative bacteria, a lot of the pathogens we see are gram-negative. So your Klebsiella, your E. coli, your Salmonella, your H. pylori, let's see what else, Citrobacter, Pseudomonas. A bunch of these are gram-negative, and what that means is in microbiology class, you look at the bacteria under the microscope, you gram stain them, and they could be gram-negative or gram-positive. Well, gram-negatives produce what's called lipopolysaccharide, or LPS. And that's one of the most pro-inflammatory metabolites we know in science. So the levels of that matter because that's directly pro-inflammatory for us. And so, Karen, if you and I were going to do a study on a mouse and we wanted it to be inflamed, we could choose to inject it with LPS because we know absolutely it's going to drive inflammation in the mouse. Okay, so if we have gram-negative bacteria present, these would be potentially pathogenic bacteria that are LPS producers that when it enters the lamina propria in the bloodstream drives inflammation and then drives an imbalance of T cells and then could result in loss of immune tolerance. Does that make sense?
Yes.
Good question. So that's how, say, even with normal probiotic levels, if you have higher, potential pathogens or high levels of gram-negatives that are dumping LPS, that you could still develop autoimmunity with good probiotic levels, right? And this is why, some people be like, well, I take probiotics. How did it happen anyway, right? There's more to health than probiotics, right? But on a simple level, again, if we're looking at a balance, you could have perfect probiotic levels, but high pathogens, and you're still, there's still an imbalance there, right? Or if you have low probiotics and what would be considered normal potential pathogens, that could still be a problem because of lack of allied forces. And if you're immune suppressed too, poor immune surveillance, now they get big for their britches, so to speak. They get brave and they start acting out. So there's all kinds of, relationships and interrelationships there that matter. So the relationship of your probiotics, which are the allied forces to your immune system, to the other bugs, and the relationship of your immune system to the other bugs form what's called a bistable bacterial neutrophil balance. And essentially, even with normal levels of say, non-pathogenic bugs, but poor levels of immunity and or probiotics, you can have an individual could have symptoms. Good question. What else?
And do probiotics work like, and I like what you said, is just because you eat it doesn't mean you're getting the nutrients from it, depending on your gut health. Do probiotics work like that as well in your gut health, where some probiotics won't be used to their maximum, or some will be, the ones that are needed will be used and the other ones will, I don't know.
Yes, so probiotics in general are more passers through. So the probiotics we swallow from, say, a supplement are more passers through. They're not going to colonize so much just from taking them. You have to feed them. And so the probiotics, or excuse me, the prebiotics, the fiber levels in your diet go further in driving colonization of probiotics than swallowing the actual capsule does. And most of this is happening in the lumen, you see. So in here, which is outside your body, but inside your colon, right? So there's not actual absorption that needs to be done of the probiotics. They need to colonize and take up shop in the mucosal barrier here, okay? And so there's various factors in the mucosa that matter, but they also need to be fed, right? So you need to be providing the fibers they like. And that's in a overall standpoint, but that's also a species specific standpoint, meaning we have to have just general fiber intake so that we have overall probiotic levels. But if you were someone who recently, in the past couldn't eat FODMAPs, then you would be avoiding onions and apples and cherries and watermelon, say. Well, just like you and I have specific flavors and tastes that we like, so do probiotics. So the probiotics that like FODMAPs, if you're avoiding FODMAPs long term, you're actually reshaping your microbiome and you're lacking those species because you're not feeding those species. So you can create an imbalance in your own probiotics by having a very restricted diet. Or if I just said, hey, I only like greens, like I'll eat spinach and kale all day, but I'm not going to eat peppers, or I'm not going to eat yellow squash, or I'm not going to eat other colors, well, then I'll select for the green lovers with my diet, but I'm going to deselect for the others. Makes sense? So that's why we want to eat broad and diverse, eat the rainbow, so to speak. Another good question. What else?
Is the boy study your personal study, or is it out? Are you going to follow that, or is there some study out there?
Which
are you
study?
Going to make that the birthing a boy?
Yeah.
Is that going to be something you're going to follow? Is that your study, or is there studies out there?
I was saying that was my anecdotal observation from my practice, which I think I read somewhere that there's some sort of association there, but I haven't dived deeper into that. But I do. It's a common question with women that have kids that have autoimmunity that, if they say, hey, they'll usually offer it up after X. I felt great until X kid, and then this happened. So then I always ask, what was the gender of X kid? And it's just kind of interesting for me.
That is interesting.
Yeah. So, I've seen it where they say it was a girl. It's not 100%, but it seems to be like, if I was betting, I'd say you're going to say boy, right? Or I should start saying, what was your son's name? What'd you name him, or something like that? What else?
It was boys for me.
Was it?
Yep, both boys are what drove me up.
It was a boy for me too.
There you go.
Girls didn't do anything. Boys jacked me up.
Yep. That's, that. So there's some sort of association or correlation there. Can we say it's causal? We'd need more numbers and stuff, but it appears to matter. Does that mean we should never have boys again? No. What we should do, and the thing I didn't mention in the video, is the conclusion here finishes with the combination therapy of microecology and drugs could be a powerful candidate for reducing the recurrence of Graves. So basically what they're saying is, hey, the drug treatment for Graves is I'm blanking right now. I can see it starts with an M. It'll come back. But essentially they give the drug and move on, okay? But what these guys are saying is, hey, why just give the drug? Maybe we could prevent flares in people with Graves, or prevent induction of Graves if we gave people microecology, or basically probiotic therapy. And they're saying specifically Bacteroides fragilis species, which we'd want to take. And then we'd also want to eliminate Prevotella, which is one of the 3 that was 85% predictive of Graves. So if we could increase our Bacteroides fragilis, decrease the Prevotella, we're influencing the microbiome in a way that will help prevent either the initial Graves event or flares of already established Graves. So perhaps, not perhaps, I talk about in my book in chapter 8 a lot, going into pregnancy, the healthier you are going into conception, the better the outcome of the pregnancy for mom and baby. So, we always want to be practicing a functional medicine type lifestyle to promote optimal outcomes for mom and baby, and prevent maybe boy-induced autoimmunity, son-induced autoimmunity, SON. What else? Any other questions or comments on this?
I have a friend who has Graves and did decide to drink the radiation, not the, what is it? What do they drink to kill the
Iodine, radioactive iodine.
radioactive iodine? Could the thyroid ever come back if you were to feed it, if you were to give it what it needs and stuff? Could you actually bring it back to life?
I don't know. I don't know that answer. Yeah, I don't know. My suspicion is no. It's like if you drop a nuclear bomb on Hiroshima, can you bring them back to life? Giving them, water and nutrition? No. So with the radioactive iodine, you're basically doing that to the thyroid. So my suspicion is probably not, but I'd like to be, hopefully my suspicion's wrong on that. And for others who aren't familiar, the treatment option is typically medication for cases that aren't super severe. If it can't be managed by the medication, then they offer radioactive iodine, which will kill the thyroid but leave it there, or you can surgically remove the thyroid. And in both those cases, now you're either pharmaceutically or surgically hypothyroid, right? So you go from hyperthyroid, they kill it or remove it, and now you're hypothyroid because you don't have a thyroid, right? So now you're on thyroid hormone replacement forever, which, requires checkups and dialing that in as well. And your levels there depend on the rest of your lifestyle too. So it becomes a constant maintenance thing either way you go. So good questions, Karen. Anyone else? And while you are thinking of your great questions, the medication is methimazole. So what I couldn't think of, I knew it started with M, but methimazole is the typical treatment, pharmaceutical treatment for the hyperthyroidism. And I guess piggybacking on the treatment aspect, I have a patient who in the past, she has hyperthyroidism, and when she developed it at like 17 or 18, and they offered to radiate it, but she was forward thinking and said, no, I'd like to have kids, someday, so I don't want the radiation in my body and any potential systemic impact that could have. So she had it surgically removed and, became surgically hypothyroid, but takes thyroid hormone replacement, has had 2 kids, happy, healthy kids, that sort of thing. So also consider if you're, childbearing age and you want kids, then the radiation is probably something you want to avoid.